One of the most prominent issues that I see in my practice is anxiety. How does that impact our health from your standpoint?
Well, we see with anxiety, people are time traveling to the future. So they're worried about something that hasn't even happened yet. And so oftentimes when that happens, they're in that anxious state. So that can be disruption, like meaning they're overthinking a situation that hasn't actually occurred and weighing all different possible outcomes. But typically these outcomes are negative outcomes. So they're catastrophizing. Oh, it's going to be awful. It's never going to work out. Instead of being optimistic or positive. And so what's really way more effective is being able to stay with the here and now. So I often talk about mindfulness and awareness, and let's talk about what you can control versus thinking about all the things that you're unable to control.
Yeah, I think that's so powerful. You know, it's interesting as a cardiologist how many times people will explain their symptoms to me and then they'll say, maybe it's just stress, you know, and often they'll describe scenarios that you just described. I love that I can give them some insights as to, you know, that presence, because you're right, the future is what drives that anxiety for a lot of people. But, you know, I'd also say for me, I don't think I'm an anxious person, but I am a problem solver, and I like imagining scenarios. I'll picture, okay, what if this happens, and then I'll do this. Is that a skill set that can go both ways? Can it cut both ways?
Well, so you are already imagining an outcome, and the outcome, I would imagine, is in your favor. Right? So that is problem solving. So people that experience anxiety will catastrophize that outcome. They actually will think it's going to be the worst. So it's not just that they're going to get on a plane, they're going to die on a plane. You know, they're not just going to take an exam, they're going to fail the exam. So it's the worst case scenario, that catastrophizing, am I saying that word again? Catastrophizing thought process that can happen with people. So what we want to work on is, okay, what is evidence to suggest that that's actually true? And the evidence is extremely limited. So we need to have evidence to show much more realistic ways of thinking. And so when we do that, and we write them down on a piece of paper, your unhelpful thoughts versus your helpful thoughts, and let's use evidence to support the reality. The reality is you're going to do just fine on this test, and this test is not going to matter in 30 days. You're going to get on that plane, you're going to get to Idaho, you're going to be just fine. Right? So everything is just working through and using that evidence to help us reframe the negative thoughts that we have.
The word that came to mind when you said this is control. You know, like if I'm planning the future and I feel like I have control over this, I'm making decisions to affect the outcome, that's a position of power. If I feel like I'm out of control, like I don't have control, I'm getting on this plane and it's, you know, crashing in the cornfield, that's going to drive anxiety.
Yes. So internal locus of control is exactly what you just defined. That's what we need to have. External locus of control, this is happening to me and I have no control over it. I'm a victim. I am helpless. That is not a safe place for people to be.
Isn't that though? Isn't that just a frame? Like, can you help people switch that frame? You know, because something happens, an event happens. That's no doubt about it. But what goes beyond that often is how we frame it. So, you know, is it a good thing or is it a bad thing? Well, we don't know yet. And I think some people are like, well, I'm just going to assume it's bad. Like, it's probably going to be terrible. Others are like, well, it doesn't look so good now, but how can I change that? Or how can this be a good thing? Is that a tool that you can use in anxiety?
Yes. So really what you're describing is cognitive behavioral therapy. So activating an event. So my beliefs affect the way that I feel and then what I do about it. So my thoughts influence my feelings and behavior. And so with cognitive behavioral therapy, or CBT, that is the most empirically researched theory to treat anxiety and mental health. And so we want to use thoughts, or we want to create evidence to help us have those more positive or neutral thoughts. And then that will change the way that I feel about the situation. And then ultimately that'll change the way that I respond or what I do about the situation. So it starts from your head down to your chest, and then to what I do. So my thoughts influence my feelings and behavior. So I change my thoughts, I change the way that I feel and what I do.
Does cognitive behavioral therapy, does that address, are you trying to get people to stop the initial reaction to whatever event comes, or is it that reaction's coming, but it's what you do after it that is impactful or changeable?
That's a great question. So cognitive behavioral therapy, you're going to have a thought. And so the thought is, I need to notice what my thoughts are. So if I'm feeling stressed out and my thought is, oh, this is going to be horrible, this is going to be like the worst, I need to reframe my thinking and think, actually, I have evidence to show that when I'm stressed out, although it can be overwhelming, I can get through it. I'm going to be okay. I can handle this. I am safe. And when I use those thoughts, therefore, my feelings, right, the level of stress decreases. I feel much more capable and confident, and therefore, I can be able to perform at an optimal level.
Beautiful.